Welcome to OSCE Success, this ultimate guide to not just passing but absolutely smashing your clinical exams. Today we're diving deep into the world of objective, structured clinical examinations. If you're a medical student or medical professional watching this, chances are you're experiencing that unique blend of terror and excitement that comes with OSCEs. But don't worry, we've gathered wisdom from candidates, examiners, and our own experience to create this comprehensive guide. So grab your stethoscope, your notepad, or just a cup of coffee, and let's transform those OSCE anxieties into confidence and competence. Our first and perhaps most foundational tip is, be confident, even when you don't feel it. As medical professionals, we often underestimate ourselves, but there's a remarkable difference between candidates who enter a station projecting confidence versus those who look like they're already apologizing for being there. Let me share something fascinating. A consultant once told me about a candidate who confidently presented some research findings during an exam. The consultant was so impressed by the candidate's confidence that he passed them, only to discover later that the research didn't even exist. Now, I'm absolutely not suggesting you make things up, but this illustrates how powerful confidence can be. Examiners are human, we respond to confidence, so stand tall, make eye contact, and remember, you probably know more than you think. A part of projecting confidence is looking professional. Even if your exam is mostly seated, dressing smartly boosts your own confidence and creates that crucial positive first impression. Think of it as donning your armor for battle. Our second tip is practice, and then practice some more. This is arguably even more important for practical exams, such as the MRCS Part B, than written ones. As an examiner, I can instantly tell which candidates have practiced an examination 100 times versus those who are thinking through the steps as they go. You want your hands to know the routine so well that your mind stays free to engage with the patient and think clinically. Notice the difference? When you've practiced thoroughly, you'll move with confidence, maintain better patient contact, and handle unexpected findings more easily. Your goal is to make these clinical skills so ingrained that they become almost automatic, leaving your cognitive resources free for clinical reasoning. Tip number 3, do not work alone. Medical exams are challenging enough without trying to do everything by yourself. Working in groups of 3 or 4 is ideal for OSCE preparation. This allows you to rotate roles between examiner, patient, and observer. The observer role is particularly valuable as they can give specific feedback that you might miss when you're focused on performing. A crucial point here, don't be too nice to each other. Constructive criticism is essential for improvement. You're not doing your friends any favors by holding back on feedback. Be kind but honest, that's how we all get better. Group work also lets you divide and conquer the vast amount of material you need to cover. Each person can become an expert in certain stations and then teach the others. This active teaching reinforces your own learning while saving everyone time. Our fourth tip might seem obvious but is commonly overlooked. Speak up and speak clearly. As an examiner, I frequently encounter candidates I can barely hear, which makes it difficult to award marks for things I can't understand. Project your voice without shouting, articulate your words, especially medical terminology. If you have a strong accent or struggle with certain pronunciations, targeted practice with peers can help identify and address potential communication barriers. Remember, communication is a clinical skill in itself. Clear communication during your OSCE directly translates to clearer communication with real patients and colleagues in your future career. Tip 5, be polite and professional at all times. This extends beyond just being nice. It encompasses how you handle the patient, your body language, and your entire demeanor. Treat simulated patients as real patients. I've seen candidates who unintentionally handle actor patients roughly during examinations. Always be gentle, explain what you're about to do, and maintain their dignity throughout. Small gestures matter enormously here. Asking if a movement might be painful before performing it, ensuring privacy, and expressing empathy all demonstrate that you're not just technically competent but also compassionate. A quality examiners are definitely looking for. Our sixth tip is deceptively simple. Read the question carefully. When you're nervous, it's tempting to skim the instructions and jump into action. This is a major pitfall. Take those few extra seconds to carefully read the scenario. Identify key terms and requirements. I've watched countless candidates fail stations simply because they misunderstood what was being asked of them. If you're feeling particularly anxious at a station, take 3 deep breaths before you start reading. This tiny pause can make the difference between comprehension and misinterpretation. Tip 7. Don't speak to the examiner unless specifically required to. Your examiner is there to observe, not to coach or reassure you. I've had many candidates ask me questions during stations. Should I do this next? Or is this the right approach? I can't help you. It's an assessment, not a teaching session. There are only 3 times you should speak directly to the examiner. 1. When explaining what you're doing during an examination, if it's not visually obvious. 2. When presenting your findings at the end of a station. 3. when answering specific questions they ask you. Otherwise, pretend they're invisible and focus entirely on your patient. Our 8th tip focuses on what you must always do, the non-negotiable basics. These are your foundation for success. Always wash your hands properly at the start of each station, and make it obvious. Don't just give a quick squirt of alcohol gel in a 2-second rub. Demonstrate proper technique. Always introduce yourself by name and role. Always ask for consent before any examination or history taking. Always start with a general inspection of the patient and their surroundings before diving into specific examinations. Make it obvious that you're looking around the bedside. Exaggerate this slightly if needed. I want to see that you notice the oxygen, the medications, the chart, or any other relevant items before you focus solely on the patient. Tip 9 covers what you should absolutely avoid doing. First, once you've asked for consent at the beginning of a station, don't waste precious time repeatedly asking permission for each question or examination step. Avoid inappropriate comments or nervous laughter. We understand you're anxious, but practice controlling these reactions. They can be interpreted as unprofessional or insensitive. If you realize halfway through that you're going down the wrong path, don't stubbornly continue. Stop, reorient yourself, and use your remaining time to salvage the station. You can still earn points by demonstrating that you recognize and can correct your approach. Finally, don't struggle through if you're feeling unwell. Speak up. Accommodations can often be made, and it's better than performing poorly across multiple stations. Our final tip addresses how to truly excel in your Huskies. How do you stand out among dozens of capable candidates? First, let your personality shine through. As an examiner, I love seeing candidates who, despite the pressure, manage to be authentic and connect genuinely with patients. A natural smile and a relaxed demeanor inspire confidence in both the patient and the examiner. Second, know your stuff cold. There's a world of difference between a candidate who performs an examination adequately and one who moves with fluid confidence, explaining findings as they go, demonstrating clinical reasoning in real time. Third, stay calm when things go sideways, because they will. In medicine, as in life, things rarely go exactly as planned. Your ability to adapt without panicking is a skill examiners value enormously. Finally, show that you genuinely care about the patient. Authentic compassion cannot be faked and transforms a technically correct performance into a truly excellent one. Remember, your examiners want you to succeed. We're not looking for reasons to fail you, quite the opposite. You have to be truly unsafe or incompetent to fail in Husky, and if you've made it this far, that's unlikely to be the case. These exams are stressful, but they're preparing you for the much more significant challenge of caring for real patients. Every hour of practice now translates to better care for someone in the future. So to summarize, project confidence even when you don't feel it. Practice until skills become second nature. Work with peers, not alone. Speak clearly and audibly. Maintain professionalism at all times. Read instructions carefully. Don't interact unnecessarily with examiners. Never skip the basics. Avoid common pitfalls. Stand out through authenticity and competence. I hope you found this guide helpful. If you're preparing for Huskies right now, I'd love to hear how you're feeling in the comments below. And if you've recently completed them, share your experiences and any additional tips that helped you succeed. Remember, you are a great clinician, and this will also soon be one of your many exploits. You've got this. Thank you for watching, and best of luck with your exams. You're not just preparing to pass a test, you're showing you're capable of caring for others, and that's worth every minute of practice.